but we should work on it because the perspectives are indeed very promising. And yes, we should start looking at them.
So you have to think about timelines, weeks, months, years.
Years. I don't have an answer yet. Thank you.
Maybe tomorrow.
Maybe tomorrow. Thank you.
Thank you. Dear audience, when I prepared my presentation, I don't know yet that I will be or not online. So I'm very happy and honored to be here face to face with you. And I want to thank very much to the organizing committee and especially for Peter to invite me. My presentation is a little bit different from those before me, because I will speak about the collaboration between Hungarian Pancreatic Study Group and our gastroenterology department. And all it starts before more than 7 years ago, when I first meet Professor Hegyi Péter at a conference of gastroenterology in Romania. We have a talk, and he talked to me about the possibility to collaborate with the Hungarian Pancreatic Study Group with the studies at that time. Shortly after that, we have enrolled the first patient in the EASY study, and under the years, we enrolled 76 patients in this study, but we cooperate in other studies too, like Emily, and just from last year, we begin to enroll patients in lifespan study. Also, twice in a year, a team with Professor Hegyi Péter and some colleagues from the Hungarian Pancreatic Study Group come to our university and have presentations about the news according to pancreatic diseases and translational medicine for the students. And this became a tradition until the COVID situation. But we need very much these meetings, and I hope that is only transitional. Many students from our university have the possibility to participate a period of time in the activities of Hungarian Pancreatic Study Group. As a scientific result of our collaboration, I can tell that we are co-authors in 41 articles and more than 200 citations. Also, we have the opportunity to participate at many conferences, and I want to thank at this occasion for all the help that we got every time we needed. And also, beyond the years, we made some friends from the Hungarian Pancreatic Study Group. Besides the scientific results, it is also a clinical benefit of the patients with acute pancreatitis admitted in our gastroenterology department, which is situated in a hospital with 28 clinical departments and a very well-functioned emergency care unit. Here you see some data about the patients with acute pancreatitis admitted in our gastroenterology department, a group between 2014-2016 and a group after 5 years, almost 5 years, between 219 and 220. You can see that the number of the patients with acute pancreatitis is increased in these 5 years. And the most important thing that we observe, it is that the mortality decreased. putting a question how we are doing it, we have some answers. And in first, we create a new protocol for procedures in management of patients with acute pancreatitis, training nurses and updating colleagues. And now if a patient in the emergency unit is diagnosed with acute pancreatitis, this patient is admitted in the gastroenterology department. The treatment became uniform, fluid resuscitation, pain management, early enteral feeding are performed. We no more use corticosteroids or PPI drugs and no useless antibiotics. So the cases with enterocolitis with Clostridium is decreased. And also we have a contrast cause kidney failure until in emergency that perform an enhanced CT scan. From some years ago, we have the possibility to perform MRCP when is needed in the first 1 or 2 days. And if ERCP is recommended, we have the possibility to send patients before 72 hours to doing this. And I'm using to present a case of a patient who come at the emergency department about 3 months ago with severe upper abdominal pain radiating through the back and vomiting. Started about 4 hours before, after a meal with mayonnaise. She has very elevated serum amylase, and only abdominal ultrasound can be performed because she was pregnant. The ultrasound shows many small gallstones in the gallbladder. So acute biliary pancreatitis and gallstone disease was diagnosed, and also pregnancy 37-38 weeks. In medical history, she has loose pregnancies, and she was diagnosed with antiphospholipid syndrome. And she told us that she had a recommendation for cesarean delivery because of myopia forte. She was admitted in the gastroenterology department, and we continue fluid resuscitation, pain management, and MRI also was performed after a day. But it shows only peripancreatic fluid exudation without dilated bile duct or no gallstone in bile duct. Her situation became relatively good, but she was anxious, scared, tired, and hungry. A medical group was formed for her to decide what to do in the next. And obstetrician, surgeon, intensive care colleagues, and gastroenterologists, we decide to begin enteral feeding. Surgeons were a little bit worried about this, but we give to her small meals with low fat, and she was okay. She had no more abdominal pain. The serum amylase decreased, and on the 4th day after admission, delivery has begun, and she gave birth to a healthy little boy. And at 9 days after admission, she was discharged. She came back to her country after 6 weeks. And she told to us about some biliary pain time to time after meals with fat. So, but the laboratory was normal. The ultrasound shows also small and many stones. So we diagnosed symptomatic gallstone disease and sent her to cholecystectomy, and it was done after 2 weeks. And little Christian Sebastian is a very happy and healthy little boy with a happy mother. And I want to mention that she signed the agreement for the lifespan study. So she is in the study. And thank you for your attention.
very much for your presentation. Challenging case indeed, and congratulations on your achievements. Comments, questions?
Just one comment. I'm really happy that we met in Nagyvárad, Oradea, in 2014, because I think what we started and the bilateral work was really excellent, and also with the university. You know, one of our strongest background people is coming also from your university, and I really wait that as quick as I can go back to Marosvásárhely again.
You're welcome every time, and I'm very happy to hear this. Thank you.
Thank you for your presentation. And